Thank you for joining us today. We'll begin shortly.
Welcome everybody to the webinar. I'll go ahead and hand it over to Kristen to the welcome start.
Hi, everyone. Good afternoon. I am Kristen Bellison, the CEO of the American College of Sports Medicine. Thank you to everyone who was able and are able to join us today, or if you're watching this after the fact, we appreciate it. I think you're going to have a really good time today hearing from a bunch of experts in exercise physiology and clinical exercise physiology, in addition to hearing from some current ACSM leaders on the importance of this issue and the importance of this topic. Thank you to our volunteer leaders who are here today, including the chair of the Certification and Registry Board, Dr. Christy Ward-Rataco. With that being said, I just want to say thank you and make sure that you save this, forward it to a friend that may have not been able to join us today, and turning it back over to Bill Kraus.
Good morning for those of you that are not on the East Coast, and good afternoon for those that are on the East Coast. And thank you for joining today. We're going to present to you the first of a series of webinars about clinical exercise physiology and exercise physiology reimbursement opportunities upon which we are working. This will be the first one, and we'll be dealing with accreditation today. And our presentation outline is as follows. We will give an overview of our task force activities, introduce our presenters, talk about the pillars of established professions, then delve deeply into accreditation, and then have a roundtable discussion. And probably the most important part today is the question and answers. We're here to present information and to hear from you so that we can more effectively function and move this process forward. Next slide, please. These are our presenters today. I am a preventive cardiologist and sports cardiologist at Duke University. I am also a physician investigator who studies exercise and health. And I'm the chair of this task force and past president of the American College of Sports Medicine. Christy?
Thank you, Bo. I'm Christy Ward-Rataco. I'm an associate professor at the University of Rhode Island. But for ACSM, I am the current certification board chair. So I work with the executive committee and the subcommittees on creating and disseminating opportunities for certification for degreed exercise professionals and those in the health fitness space. Walt.
Hi, Walt Thompson, Regents Professor Emeritus at Georgia State University, a former Associate Dean for Graduate Studies and Research, a former President of the American College of Sports Medicine, and presently I serve as the Executive Director of the Committee on Accreditation for the Exercise Sciences. Ben?
Thanks, Walt. I am Ben Thompson. I am a Program Director and Professor of Exercise Science at Metropolitan State University of Denver, and I am the current chair of the Committee on Accreditation for the Exercise Sciences. Brittany.
Thanks, Ben. Brittany Overstreet. I am an assistant professor and program director of the Clinical Exercise Physiology graduate program at the University of Delaware. For ACSM, I sit on the credentialing committee, and for CEPA, I am the co-chair of the legislative committee. Monty. We can't hear you, Monty.
There you go. Thank you, Brittany. Appreciate that. Monty Ward, I'm the Vice President of Government Affairs for American College of Sports Medicine. I'm the eyes and ears on Capitol Hill as we move and try to work through legislation that's moving its way through the Congress and through the states. And I'm happy to be here and I'm one of the staff members that are working on this issue in this task force. Francis.
Hi, my name is Francis Merrick. I'm the National Director of Certification here at the American College of Sports Medicine. I'm happy to be here.
So I am so excited to have this task force established, and I wanted to share with you why. I have been involved in clinical cardiology and director of cardiac rehabilitation here at Duke since 1994. And I've been frustrated by the fact that our clinical exercise physiologists are not recognized for the incredible amount of expertise and responsibility they bring to their roles, particularly in cardiac rehabilitation. And I rely upon them daily to help me interface with patients, recognize problems, bring them forward, and help resolve them. When we were starting to develop a mobile cardiac rehabilitation program and figuring out how to bill for it, it became acutely apparent to me that this was going to be a problem, that these exercise physiologists were not recognized for their expertise and could not bill for their services since they are basically performing that service. I've heard from many of you over the years how this is a problem, and 2 years ago, we decided to bring this forward and make it a priority for the college. And so I'm excited to help share with you what we're doing, what the goals are, and how we're going to move this forward today. So let me pass it on, I think, to Christy in the next slide.
Thank you. So, the goal of the task force and one of the visions of the certification board is to make sure that we're positioning degreed exercise professionals and health fitness professionals as essential members of healthcare teams in the healthcare continuum. So we want to protect the space for those of us with education and training and exercise prescription and education, and ensure that degreed exercise professionals always have a place and a role and a space to practice their knowledge, skills, and abilities in this particular area. Next slide. And so our ultimate goal is to establish a referral network for physicians and exercise physiologists to be able to communicate. As is done in many of our peer allied health professions. But to get to that ultimate goal, there are 4 pillars of these professions. And the first pillar is programmatic accreditation. And so it's essential that our field have accreditation and recognition that each of our professionals is being trained in a similar manner and has similar knowledge, skills, and abilities once they enter the workforce. And so that's really important for workforce development. So that is step 1 in this particular 4-step process. What's great is that we do have professional certification that's accredited by an outside body. Those certifications do have required continuing competence going forward as they move across the profession. And we do have registration available to us through our US reps opportunity that is a collaboration between ACSM and this particular organization. And so we have a number of these steps in place for that referral network. But this is why we come back to number 1, and this is why ACSM has made programmatic accreditation an important priority for our organization to move forward. And so this will all help us in our establishment of exercise physiologists as qualified healthcare professionals and help us move towards reimbursement for our services. So I think, Monty, I think you're going to take us through this if you feel ready.
You're muted, Monty.
There we go. Sorry, I was sitting there waiting. I was muted by the organizers. I was trying to wait for, I was clicking the button multiple times. So let me kind of walk you through this. And Chrissy, I appreciate you kind of talking about those pillars and what we're kind of working for as for CEPs and EPs. And I think as we kind of started delving into this project, we found that there are some things we already have in place. There's some things that we really have a long way to go before we get to the point where we can get our CEPs and EPs ingrained into the healthcare system and being reimbursed by the system itself. And so as we look through this kind of chart, we put this together to kind of help us to be able to kind of walk through the flow. Today we're talking about programmatic accreditation, but there's a number of other things we have to check off before we can get to the point where we will be an important part of the healthcare system. Christy talked about professional certification. We have that. Recognized profession, where we've got that box checked. Professional registration, we have that through US reps. But then we start to get to the point where we need to kind of start working through this process, and it includes many different players. It includes work with the AMA, CMS, insurers themselves. But we have to kind of go through this process before we can get to the point where your CEP and an EP is reimbursed. We have to make sure you're listed as a qualified healthcare professional. NPI number and national provider identifier. Fortunately, CEPs have that. EPs do not at this point. So we've got to work through that to get that taken care of. And then we get to the CPT codes and really kind of getting involved in that process. There are many examples out there of where other organizations have used the CPT codes in order to become reimbursed for their services. But we still have to go through that process and what that might look like. So as this is kind of a high level, a 30,000 foot level of what we want to do as far as an ideal state. But we've got a long way to go, and this is not going to be an easy process. This is one that's going to take several years to get through this. But we think it's worth it, as Bill mentioned. We looked at this issue and saw that this is an issue that the college really needed to highlight and really kind of take on as a priority. And so that's what we've done. So I believe I'm supposed to talk about this slide as well. So let me kind of go into that too. When we started to go with this process, we realized we got to kind of build that foundation and put these pillars in place that would allow us to be able to work towards that reimbursement. And the first one is accredited education. And so that's why we're here today to talk about that. And we'll get into a little more detail as we get along in this process here in this webinar. But that's the first thing we have to do. Then we have to have that certification, which we do. Then we have to have continuing competence to demonstrate the ongoing professional competence through continuing education. And then we have to have that registry. The US reps fulfills that for us very nicely. and we want to be able to keep that because it does allow us to be able to track people that are registered, and if there's anything that goes wrong, it's a process we can use to be able to deal with that. So these are kind of the 4 pillars, and Christy hit on most of these already, so I'll turn the time back over to Christy.
All right, so as we've sort of emphasized as we've gone through this, is that, we really have all the pillars in place that allow us to move the profession forward. But what we're missing is universal accreditation across programs. So accreditation is available through the Committee on the Accreditation for the Exercise Sciences. But as accreditation has become available and been available across a number of years, what we're seeing is that the number of unaccredited programs and related programs is larger than the number who are voluntarily engaging in accreditation. And so this situation is, creating some discrepancies in content and curriculum and program structure between departments. Now, what we're really seeing, though, is that many departments are covering all the important areas that need to be covered in our educational scope and practice. And they really are providing the knowledge, skills, and abilities required for us to send people out into the workforce competently and safely. But as a profession, we need that to be universal across programs for us to move forward for these other initiatives while we try to protect the space for degreed exercise professionals. And so this is the reason why the ACSM Certification Board decided that it was very important that ACSM certified professionals graduate from accredited programs. And that's why we put in our requirements that by 2027, individuals sitting for these exams must graduate from co-AAS accredited institutions. And so what we're really trying to do is make sure that it's understood to the public that the knowledge, skills, and abilities acquired by degreed exercise professionals are universal across these programs, so that we can assure the public that the individuals interacting with them in this space are competent and safely engaging in exercise prescription and education for all the individuals involved. So I think we can go to the next slide. Thanks. And I think Ben is going to take us through some of the information about co-AS.
Yep, thanks, Christy. So just a couple things about accreditation, and Walt's going to talk a little bit more about that after me. But I think there's a lot of misconceptions about the accreditation process and what the co-AS actually is. So CEP, the Committee on Accreditation for Allied Health Education Programs, is the actual accrediting body. And the co-AS is just a committee that makes recommendations to CEP regarding accreditation. So the committee, the co-AS, we're the ones that actually go out, do all the legwork with, doing site visits for programs, reviewing curriculum and things like that. But we actually then make our recommendations to CEP. And the co-AS is made up of multiple sponsoring organizations. So it's more than just one organization. And I think that's something that people are often wrong about. Even in my institution where I'm at, they think it's an ACSM accreditation. And that is not true. We're in fact made up of multiple sponsoring organizations. And the process to get competencies and these knowledge and skills for these programs comes from all exercise professionals. And all those exercise professionals provide feedback to make these competencies for the accreditation. And so I think that's a really important thing to understand is the information that we use comes from the exercise professional industry. And it's not one specific accrediting body or certification. Walt, do you want to talk about some myths?
Yeah, I'd love to. Just to emphasize something that Ben said, however, is that it's the Commission on Accreditation of Allied Health Education Programs, CEP, that is the accreditor. The accreditor is not the Committee on Accreditation for the Exercise Sciences, the COES, nor is it ACSM or any of the sponsoring organizations. And Ben's quite right, the COAES reviews and makes recommendations to CEP for accreditation, which puts us in a unique situation in which we can help programs achieve accreditation. So when you look at the self-study and it looks like a whole lot of forms and things for you to fill out, it's not as complicated as it looks, and we are, the COESs, in a position to help you with that and not to create barriers or anything else. It's simply there to help you. As an academic dean for 8 years, I know what it means when someone tries to lean in on my academic freedom. I can assure you that CAHEP is not in a position to take away your academic freedom. In fact, the CAHEP accreditation is what we call outcomes-based and not process-based. So those of you who are in academia fully understand the process-based accreditation. Process-based accreditation includes things like, I want your students to take 6 hours of biochemistry and 9 hours of physics in order to be an exercise science major. That would be process-based. CAHEP doesn't do that. CAHEP is more interested in what happens to your students once they are educated by you and go out into the workforce. So there is no limitation on your academic freedom for all of those of you who have expressed that to me and to others. We simply look at your curricula so that it matches the clinical exercise physiology certification in this case, or the exercise physiology certification. The second point that I wanted to make sure that you understood was how much it costs and how much time it takes to become accredited. Again, those of you who are in academics understand the process-based accreditation better than outcomes-based accreditation, and know that some of these accreditations take months, if not years, to fill out, and with changes in curricula and things like that. I can assure you that the application for accreditation that the COES will review and help you along the way takes really a minimum amount of time. The second is the cost. I've also heard from institutions that accreditation is very expensive. Well, the COES understands that. So our fee of an annual fee of $500 is on the very low end of accreditations. And we even went back a year ago to January of 2020 and made the strategic decision because we knew that COVID-19 would impact the budgets of all institutions. The COES determined in January of 2020 to waive the initial application fee of $750 and move from face-to-face site visits to virtual site visits. And that way it doesn't cost the institution anything at all for a site visit. So what I'm saying is that if you want to become accredited by CAHEP through the Committee on Accreditation for the Exercise Sciences, it doesn't cost you anything until the first year you become accredited, and then it's a $500 annual fee. So again, to emphasize that a lot, is that if you want to become accredited by CAHEP through the COES in the exercise sciences or exercise physiology, it doesn't cost you anything. And the third point's already been made, but I'm going to make it again. CAHEP, the Commission on Accreditation of Allied Health Education Programs, is the accreditor. They accredit over 2,000 programs across the country and internationally as well. We're only a small part of that. So it's not an ACSM accreditation, it's not a COES accreditation, but it's a CAHEP accreditation. And again, COES reviews and makes recommendations for accreditation to CAHEP. Thank you, Ben.
For the roundtable, we'll hand it over to Bill. I think you have a series of questions here, but Walt, I think you wanted to ask Bill some questions about the certification and workforce development. I think you wanted to kind of walk through that a little bit. Do you want to do that now?
Yeah, Bill, I'd like to ask you a question as a practicing physician and running a very important cardiac rehabilitation program in North Carolina. You mentioned this before about how passionate you are, but what about the daily activities? You're in your cardiac rehabilitation program. How much do you lean on your clinical exercise physiologists?
Tremendously, Walt. And in fact, So Medicare, for example, and then all the other carriers follow Medicare, requires physician oversight of every single session of every single patient. And I'm there to deal with problems and follow up with problems. And we see as many as 50 patients in a session. And I can tell you there are many days when I'm covering rehab where I don't actually have to deal with any issues, because every single one of those patients during their time in the facility has had their problems met, their problems identified, their drugs certified that they're taking them. Any particular physiological issues I might be consulted on, but there are many days when I really don't have to interact. So these people are very qualified to deal with frontline medical issues that are very complex, and to the patient, very problematic, and do it in a very professional way.
Thanks,
Christy,
Bill.
one of the,
Go ahead.
Christy, and we had some discussions about accreditation and certification, programmatic accreditation and certification. And did you want to talk through that a little bit?
So I think the most important thing that we want to emphasize, and I think both Ben and Walt discussed this a little bit, is that, again, accreditation is not an ACSM accreditation. It is it's an accreditation from an outside source, basically ensuring that your program covers the minimal competencies that allow your students to go out and serve the profession with the knowledge, skills, and abilities that make them minimally competent. And when we say minimally competent, that doesn't mean that they're, not ready for anything. It just means that we can assure the public that there's a level of knowledge, there's a level of skills, there's a level of ability that ensures that we can say to the public that they are safe interacting and doing the job required of them. And as ACSM is a sponsoring organization of the COAES and CAHEP, we have some input into what knowledge, skills, and abilities and competencies we expect from individuals when they go out into the industry. And so as a sponsoring organization, we believe in what COAES and CAHEP is doing, and we have input into the knowledge, skills, and abilities, again, that they put into the requirements of the competencies of the graduates of those programs. So I just really want to emphasize that ACSM doesn't get anything on their bottom line by aligning with COAES and CAHEP. We simply are able to give input into what is necessary for our degreed students to go, or degreed professionals to go out into the workforce and be competent in the profession that we're saying that we're sending them into. And so again, it really all goes back to our peer aligned professions that we see ourselves similarly educated with. They have programmatic accreditation as a part of their profession. And so for us to be aligned with those peer professions, we also need to have this sort of like universal commitment to teaching and creating competent degreed individuals before they go out into the workforce. And I think what's wonderful about the COAES and the CAHEP accreditation is, like both Ben and Walt said, we're not going to tell you how to do it. We're just saying these are the things that need to be covered in the curriculum. These are the things that students need to be able to do when they leave our degree programs, but you can do those in whichever way you like. And I think that makes this particular type of accreditation different than some of the others that individuals may have gone through. For instance, athletic training is very prescriptive because that's what they've decided they need to do as a profession. We, on the other hand, believe that these competencies really allow us to send degreed exercise professionals out into the workspace and do a wonderful job. And so it makes it so you can do this however you like across your curriculum. so you can preserve your academic freedom as you do that. And so while it sometimes feels overwhelming when you're looking at these particular things, when you actually start looking at your curriculum, because people do a wonderful job at getting students ready, these things are in your curriculum already. You just have to show that they're being done at the departmental level in your classes. And so I really want to emphasize that there is a separation between ACSM and COAS and CAHEP. But as a sponsoring organization, we believe in the direction in which this accreditation is going. And if we do have universal accreditation required for these certifications, it is going to help us move the profession forward, protect the space for degreed exercise professionals, and hopefully eventually get them the recognition they deserve as, reimbursed parts of our medical profession.
Christy, I'd like to add on to that as somebody who's recently gone through this process, and just somebody that is really focused on, as many of us, most of us on this call are, getting professionals out into the field. I truly believe that if we do not have the stamp of approval to be able to show who CEPs and EPs are, what they do, what their qualifications are, and how those qualifications are in line, as you said, with these other allied healthcare professions, we are going to risk losing our space in the field. We are going to lose these high quality jobs that we know EPs and CEPs are perfect for, to the athletic trainers, the physical therapists, the nurse practice, for various nurses. And I think that we need to really, really keep that in mind as we continue to, weigh out the pros and cons of all these decisions being made, that this process of accreditation, which in my experience was, I have nothing else to compare it to. It was my first time going through an accreditation, which is kind of daunting all in itself. But I had a great experience with all parties involved. I thought everybody was very timely and responsive in their communications. These steps were very clearly laid out. I was able to take my time and able to work and navigate all of the requirements, and then being able to bounce ideas off of several different people within the organizations for feedback and for help to get my questions answered. Honestly, come day of the virtual site visit, it was a breeze, because all the work had been put up front to make it so, and that took an entire team effort. So I really feel like, while it might not be necessarily something that is at everybody's top list, because there is a lot of work involved, this step is one that must happen in order for us to 5, 10, 15 years down the road be able to really progress the field and ensure that we have good jobs for good EPs and CPs that are actually going to, again, help us sustain our profession.
Can I add something to that, Brittany? Thank you for that. This is Walt. Two points. COES has recently made the decision to extend the COVID-19 fee waiver program through the end of the spring semester 2022. Whether or not it gets extended beyond that is going to depend on the behavior of COVID-19, because it's the face-to-face visits that are really the critical aspect of this. However, we've had some very good experiences with the virtual site visits. So the COES will make that decision sometime in the spring, but at some point that's going to end. And my guess is going to end probably sometime in the summer. We'll go back to site visits. The point I was going to make is that once that program ends, the COVID-19 fee waiver program, once it ends, institutions will once again have to pay for the cost of a face-to-face site visit, and that's 2 site visitors coming to your campus for 2 days. And the other thing I wanted to mention was that I've talked to several institutions in the last week or so that have expressed to me the desire to wait for academic program accreditation until it gets closer to the 2027 deadline that ACSM has established to sit for the exercise physiology and clinical exercise physiology certification exams. That's not helpful. What's helpful for us now, when we're trying to do all these other things with clinical exercise physiologists, is to get academic programs accredited now, not near the end of the deadline for ACSM, but to get these programs accredited now so that Monty can do his work in DC and he can walk into these offices and saying, look, we have dozens of programs that carry this academic program accreditation by a third party, well-respected accreditor. So if you're hesitating or thinking you're going to wait until the deadline, it's not helpful. Contact us now so that we can get your program accredited. Thank you.
Let me build on that just a second, Walton. Thank you for bringing that up, because you touched on a point that I wanted to bring up after listening to Brittany speak. But it is important to have that credibility when you're going in to talk to different agencies and members of Congress, to be able to talk about the credibility that we have as an organization, as a profession. And so it's very important to be able to say these are accredited organizations or accredited institutions that we can then turn to be able to train and teach our professionals. The second thing Brittany mentioned, though, that I want to kind of also bring up is the fact that there are other professions that are looking at expanding their scope of practice to be able to include some of the things that a CEP and EP does. And we need to be able to make sure that we protect the jobs that are out there, and even increase the availability of other jobs that they might be able to perform as part of their training. And so that's why it's so important that we take on this program, this process, to be able to get to that point where we can get reimbursement, so you can, do the services that you've been trained to do. And so that's why it's very important for us to act now, and that's why we're in the process of going through it now.
If I can make a quick comment too, building off of what Monty and Christy said. So I was recently had the benefit of doing a site visit at a program that was just fantastic. And I was speaking with a clinical nurse manager. And when I was talking to that clinical nurse manager that was working in cardiac rehabilitation, they said that they had no idea of the experience and knowledge that a clinical exercise physiologist has coming from an accredited program. And I was a little disappointed in that. And, I think part of what this is like Walt says, is we need to make our profession known. And it's not known right now because there are so many things that, a certified exercise professional can do in whether it's a clinical setting or a non-clinical setting, but a lot of people don't understand that. And accreditation is a big part of that, is helping industry figure out that, okay, if I know somebody is coming from this accredited program, they should know this, 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 and this. And that's a really important component of accreditation.
And just to piggyback on that, Ben, one of the strategic priorities of the CCRB going forward over the next several years is really to increase our employer engagement in the hopes of increasing our workforce development. So again, really as an organization and as a certification board, engaging with employers so they do know the unique skills and abilities that degreed exercise professionals have. Because both EPs and CEPs have a very unique skill set because of their training. And we haven't done a great job previously getting out there and making our skills known. And so please note that that is one of the strategic priorities of the CCRB over the next several years. And so if people have ideas about how we can do that better, and how, people involved in this process can help, please let us know. Please reach out to myself and Francis, because we're really interested in hearing, how you think we could do this better, because we know we need to do it better. So thanks, Ben. That's a really important point.
Totally agree, Christy. And I think too, to mention to everybody on this call and everybody that's going to be listening to this in the future, that we need numbers when it comes to advocacy. We need every single EP and CEP out there to be on the same page, to have the same communication, to have the same mission. And so in addition to what this current task force is doing, I know ACSM and CEPA both have great great committees that are doing a lot of different projects and work. So please reach out if you're interested in doing this. And again, one of the things that accreditation will do is help standardize that communication and that mission and that statement so that we can all go forward as a unit instead of kind of a divided force.
In fact, if anybody wanted to sign up to make sure that they were part of that process, they could go to the ACSM website, go to our policy center there, and from there you can enter your email address, and it'll take you to another screen that'll add you to, have you add your home address, and then you can click the button to be a key contact, and we'll put you to work. That's for sure.
There is a number of questions that are coming in from the audience for the team. So did you want to go ahead and go to the next section, or did you want to continue with the roundtable? I'll leave that to the group. You can give me a thumbs up on your cameras if you want to move forward, or if you have other questions from others. Okay, good. Okay, so let's go ahead and switch to the next question and answer part. There's a number of questions here, so I'm going to try to get through these as best I can. And then point it directly to this presenter on the board, on this panel. So one of the questions was related to kind of the licensed professions and the clinical exercise physiologists, and so I'm going to read the question. What overlaps and hurdles have developed in meeting the discussing reimbursement eligibility with physical therapy, cardiac nursing, and other allied health professions in research professionals working within the cardiac rehab in hospital settings? So let me hand that over to Monty and to Bill Kraus. So talking about the licensing, how clinical exercise physiologists and exercise physiologists intersect with other licensed professions.
Bill, you want to take that first, and then I'll go into the licensure issue on the political side.
Yeah, I think, I mean, I can only speak to Duke because I've only been at Duke my whole professional career. And I believe that physical therapists are recognized for what they do, and are very active in the rehab space. But they don't really interact a lot at our program with the treatment, day-to-day treatment of and session-to-session treatment of cardiac rehab folks. They're mostly hospital-based in my experience, although there's a good physical therapy outpatient clinic here focused on sports. And the physical therapists run the pulmonary rehab program here at Duke. The nursing interaction is very different in my space. They do the intakes, they identify the baseline problems, but again, even though in some programs they do the day-to-day care, that's not the case here. The problem is that I don't think that the clinical exercise physiologists, and in fact I know, are not recognized for their level of expertise, and nor are they compensated that way. And there's a misunderstanding at Duke about certain levels of experience and patient care. And I'm trying to deal with that at my institution, but if it's going on here, I can tell you it's going on other places as well.
Thank you, Bill. And let me kind of just touch on the licensure part of that, because we do get that question quite a bit. You know, why aren't we going after licensure? And quite frankly, I don't like to talk about the word because it's not it's not something that I think is very helpful when we're talking about, you know, getting CEPs and EPs ingrained into the healthcare system. Because, you know, there have been several attempts in states to be able to get licensure done for CEPs and EPs, and those states have usually not been successful. Those efforts have not been successful in getting licensure in the states, and it's for several different reasons. Some are just some of the things we're talking about today about not having the accreditation and all the things that go along with that, and some are the process, the fact that they're not reimbursed at that level. And so There's several different reasons, but then there's also the reasons that there's political organizations out there, organizations that have a lot more resources than we do, that are very successful in working with the states to be able to make sure they protect the things that they want to in their states. And so it's very difficult. But as we were kind of going through this process of evaluating the best way and the forward to be able to get reimbursement for CEPs and EPs, we found that even licensure was not the end-all be-all. You have Louisiana, who has licensure in their state, but CEPs and EPs are not getting reimbursed in those areas to the level that they should be. And so we found that that was not really the answer for us to be able to get CEPs more ingrained into the system. So this is why we've gone this route. The fact that we've gone through, trying to get people to recognize them as a qualified healthcare professional, and then working towards reimbursement through the CPT code structure. And we found that that's going to be our best bet because it does allow us, to ultimately get you paid for the job you want to perform, for the job that you've been trained for. And so that's really why we want to go through that process and through this avenue for us to be able to get you ingrained into the healthcare system.
Monty, I think it's important to go back to that flow chart that we showed earlier. And if you look at the connection between programmatic accreditation and CPT and reimbursement, licensure is nowhere on there. It's the qualified healthcare provider. Licensure does not equal reimbursement. Licensure equals why am I drawing a blank now? But they are going to be making sure that individuals are up to certain standards. And so if we go through the process of licensure, many hoops, as the question was alluding to, many different barriers. Licensure is regulation, it is not reimbursement. And so with this qualified healthcare provider, this is a more direct route to getting us as CEPs and EPs to our goal of being reimbursed and being able to practice in the settings that we currently are in a greater capacity, as well as with other clientele and patient populations that we know that we should be working with. We just don't have the funds to do so. And so I think that's really important to keep that in mind when people are trying to, again, go back and forth with this licensure discussion. In my opinion, the effort needs to be on this qualified healthcare provider or professional and really pushing that forward, because that is going to get us where we want to be faster.
And
the next question go ahead, sorry.
That's okay.
I was just going to emphasize one thing that Monty had said is very important, and that licensure is a state issue. It's not a federal issue. So when people come to us and say, hey, why isn't ACSM pushing licensure? It would have to push licensure in 50 states. So if you're interested in licensure in your state, then you're going to have to take the lead on that. Because it's not a federal issue, it's not a national issue, it's a state-by-state issue, and that's why there's only one state in the country that has a license for clinical exercise physiologists. So it's not helpful to go to ACSM and say, ACSM, why aren't you pushing licensure? Well, it doesn't, because it's not a federal or a national issue, it's a state-by-state issue. Thank you.
Well, and I'll say it again, well, and appreciate that. But even if you get licensure, it doesn't mean you're going to get reimbursed. It doesn't mean that you're going to be, have a job that allows you to be able to operate within the healthcare system. So, I mean, the CPT code structure, going after that reimbursement in this way, going after the qualified healthcare professional, that's the way that we can get you in there. Now, this is not going to be an easy process. It's not something, in 2022, now all of a sudden you're going to be ready to go and reimbursed. But it is a long-term process. But it is something I think that ACSM is willing to take on because it's important for the profession, and it's important for it to be able to get the CEPs and EPs involved in the healthcare system.
Okay, so the next question is going to come in, and then I'm going to go, we're going to change a little bit of gears and we're going to come back to kind of the scope of practice question. So the next question is to Walt and to Christy. If accreditation is already accredited for the bachelor's degree in exercise science, what will need to happen to develop a master's program in exercise science to get it accredited?
I
think to Walt first.
Yeah, I think I understand the question. So so CAHAP has 3 accreditations in our disciplines. Personal fitness trainer, typically those are certificate programs or associate degree programs. Exercise science, typically for baccalaureate degree granting institutions. and exercise physiology for graduate programs. So we do have an accreditation for exercise physiology. We call it exercise physiology for graduate programs, exercise science for undergraduate programs, and personal trainer for associate degrees and certificate programs.
So the next question is to Christy. So this question is, how do we communicate the value? I'm trying to kind of piece it together a little bit. How do we communicate the value of exercise physiologists and clinical exercise physiologists to hospitals when they're hiring? So I'm talking about employer engagement. What is the CCRB doing about that?
So I think that's a great question, and I think it goes towards our strategic priorities in that we as a profession need to start engaging with human resource professionals, and those who work in the space need to communicate to their managers and their hiring managers the importance of these particular qualifications. So I think it's a two-way street in that individuals working in the space need to advocate for themselves and their peers. And then as an organization, we also need to do some informational campaigns. You know, how to do that efficiently and effectively, we're definitely going to have to engage with some outside resources and consulting agencies, because as researchers and exercise physiologists, that's not necessarily, you know, our realm. And that's why, you know, there's people out there that do that professionally. And so, you know, we are going to do our best to find the best resources. What's wonderful is that the ACSM staff is invested in helping us to do this. So as volunteer leaders, we'll be doing this, as ACSM staff will be doing this, and there'll be some sort of outreach. I don't know, Francis, can you comment from a staff perspective on any of that?
So from a staff perspective, I think one of the things when they're looking at engaging with employers, I think one of the things that the certification board is looking at is, you know, being able to provide information about how an exercise physiologist and clinical exercise physiologist is prepared for the workforce. I think is be able to describe that to employers, I think is one. And the second one is providing information about salaries and things like that, so they can have it at their fingertips. And I think a lot of it's assumed that people know. And I think ACSM and the certification board is really actively looking at, you know, being able to provide information to employers so that they can make informed decisions. I think a lot of the folks don't know from the employer side, based on kind of conversations that I've had, is how did you prepare for school? Why do you have a degree in exercise science? What kind of expertise did they have? Did they have experience before they get to the workforce? And I think that's because that isn't there. That's part of the long-term planning for the board is they're going to be looking at in 2022. So the next question is, this is kind of to Monty. Oh, sorry.
I just wanted to say, CEPA is planning on a webinar that will kind of address like a to-do list for essentially talking with HR and your cardiac rehab directors. So make sure that you follow CEPA on social media and keep an eye out for that to be coming soon.
So the next question is talking about scope of practice. So I'll hand this over to Monty. The APTA is currently working on expanding the scope of practice of physical therapists to include wellness. Are we working with APTA to obtain their support for the role of clinical exercise physiologist in healthcare? So that's for Monty.
Yeah, thank you, Francis. And you know, one of the things I can tell you right now is that the American College of Sports Medicine, we are one of the founding organizations of a group called the Physical Activity Alliance. And as part of our work within that alliance, APTA is a founding member as well. And so we work with them a lot on this issue about how we can work together to be able to increase all of our efforts, you know, to get people reimbursed for that services they provide. So we are working with APTA, we are working with the NATA. There's a number of organizations, there's 14 organizations as part of that alliance. And so as part of that, we work with them very closely on this issue. The PAA has a working group that is looking specifically at this, what it is to be able to have people reimbursed for exercise prescriptions. And so we're really kind of looking at what that might look like and going through that process. And so we do work with them on quite a bit, and it is somebody, you know, that obviously they're not the only organization out there trying to increase their scope of practice, but we work with them quite frequently to be able to say, here's what we need to do, and so far it's going well.
So the next question is, if we want third-party coverage, don't we need to identify the medical problems we are addressing? If so, what medical populations are the focus of this task force and why? So I'll hand that to Bill. Did you hear that? Did you hear that one, Bill?
I did. This go-to meeting is a challenge with muting and unmuting. Not only do you have to know where the button is, you have to be dexterous in finding out how to push it. Yeah, so there's a broad range actually of medical conditions in which exercise physiologists are engaged. Everywhere from cardiology that I've talked about to pulmonary medicine to rheumatology and to cancer. All these conditions, in fact, every medical condition that I've looked at or that Physical Activity Guidelines Advisory Committee has looked at is favorably modified by increasing physical activity. So any one of those medical conditions, Alzheimer's, neurology, I mean, all these are open fields in which clinical exercise physiologists and physiologists can be involved in patient care and improvement of the quality of life of our patients.
So I think to kind of dovetail on that, I think we can maybe, if we want to discuss that from the task force perspective, I think one of the things that the research subcommittee was looking into that yes, exercise is efficacious. I think that was clearly defined as kind of what Bill was saying. But I think that the challenge is being able to clearly identify that the exercise physiologist and or clinical exercise physiologist is uniquely trained to work with those populations. We have tons of research that says exercise is great and helps people, but we don't really have, there's not really a lot of research that's out there that says, well, the EP or CEP is the right one to do it because they have the education experience to do that. So I think that's one of the key things to discuss there. What are your thoughts on that, Bill?
Yeah, so this gets back to the accreditation issue. Right? I want to be able to say that my folks are qualified to do this work because they have the education that is required, and then obviously then the experience, but the education that is qualified to allow them to address the problems that are going to be faced. Consider stroke, for example, right? And understanding the risk factors associated with stroke and how to deal with those issues. And making sure that across the field, we have a uniform level of education to which we can point will allow us to do this on a national basis. Otherwise, we're dealing with our own HR departments, and that's a hard sell.
Here, looking through the questions. Another question is that how is the task force engaging with regional conferences? I'll leave that wide open to everybody.
I can speak to the Mid-Atlantic. Actually, Dr. Jamal Ozimek and myself just presented on this very topic at Mark ACSM, kind of more towards students, and then we actually presented at Ball State University more towards the professionals. So we definitely welcome anybody who is interested in presenting at regional conferences to feel free to reach out to us. We're more than happy to share our slides and again start to synchronize the message that's going out there so that everybody's on the same page. And the more times that we can get this presentation across the country, the better. Going back to that point that I made earlier about numbers, we need everybody on the same page and we need a lot of people on that page. So feel free to reach out to me. I don't know if I can put my information out there, but if so, feel free to reach out. I'm happy to share our slide deck.
I was going to say, and I gave a similar presentation in the New England region this year at the regional chapter meeting on, the importance of these 4 pillars as we work towards trying to get CEPs and EPs recognized as qualified healthcare providers. there was some lively discussion and some really wonderful ideas from the audience. And so it was a really wonderful experience for me to chat with, mostly faculty about how ACSM can do a better job at promoting accreditation, promoting certification, and really creating the resources necessary that allows for the ease of accreditation and also preparation for students to become certified. And so it was great to hear from faculty, what do they need to make these things easier for their faculty to implement and in their departments. And so I think across the board, we really need, almost like checklists or a playbook for people to utilize. And I think ACSM is responding to that request. And so if there are resources that you need, the key is to let us know, because we're really happy to, try to figure out how to do that. And we are a wonderful organization with so many resources and so many people with resources. And, I think everyone is really engaged in trying to make this as easy as possible. Additionally, going back to how are we engaging with regional chapters, we do have a communication plan in place as a CCRB executive board to ensure that this information, as well as information about certification, is being disseminated at regional chapters the rest of this academic or this calendar year, as well as into next calendar year. And again, if you're interested on presenting on these issues to your students at your university, in your region, please let us know, because we have resources available. You don't have to start from scratch. We've got a lot of great presentations that you can use as a base, and then, individualize as you see fit.
So the next question is to Walt and to Bill, as changing your hats a little bit on putting on your past president ACSM hat on, and then it's also to Christy. So if you can discuss this in kind of different ways, and I guess this would be to Monty as well. So this is a broad question. I've been hearing about this sort of thing since I was an undergraduate. What's different now? So I will lead that to the past presidents of ACSM. Is why is this different now in comparison when we've heard this in the past?
Oh my goodness. I all I can speak to is the fact that I think there was a consensus uniform within the leadership that this needed to be done right now. And I think that was absent in the past. That's all I can address. Maybe Walt can comment on that.
Yeah, right now we're, Bill, as you know, we're surrounded with very passionate young professionals like Christy and like Brittany and like Ben, who have pushed this issue to a point now where it would be a disservice to the membership of ACSM if we didn't do it. It has been discussed for a long time, but we haven't had the numbers of institutions who are teaching in the clinical exercise physiology area to have a good enough number for us to be making these kinds of decisions and placing these kinds of resources in this direction. So it's like kind of all the stars aligned just at this right moment, where we now have, and you saw those slides, we have academic program accreditation, we have a third-party accredited certification program, and now we've got all these other pieces that are falling into place. So right time, right moment to do this.
And just to piggyback on that, I think the other thing that's different is, we've talked about requiring accreditation to sit for degreed certifications for a number of years. And Mayor McGall and the executive committee, prior to me coming on as chair, really decided that was the legacy that they wanted to have. And that went into, that was voted to be approved by the executive board of the CCRB prior to my, taking over as chair. And I'm excited to be able to help foster that. So I think the other thing that's different is we put it out there that for you to take our degreed certifications, those that require a bachelor's degree or a master's degree, you have to come from these accredited programs. And I think that is, really putting the message out there that this is important to the future of our field. And so, I think that's also what's different is we finally said this is important enough that we're going to take a stand and we're going to make a policy as an organization. So I think that will actually help us as well.
I think also we were, as we discussed previously, as Amonte so eloquently discussed, I think frankly we were distracted by the word licensure. And then once we realized that isn't going to get us what we need to be able to bill, it redirected our attention to the pain points and how we can now develop a strategy to address those pain points.
Okay, the next question, this is to Ben. If a site visit can be done virtually and lower cost, then why is there a need to do a 2-day in-person site visit? And I guess that goes to Walt as well.
Well, it's a good question. So, I mean, currently we're doing virtual site visits, and at least through the spring. If or when we ever do go back to in-person site visits, I think often the volume of information that site visitors have to review during those site visits can be a lot. But me personally, I think the interaction with the students, the faculty, advisory board, there's much better interaction in person than there is virtually. And I think a lot of our profession is making those connections. And whether it's, between a site visitor and a program director or something like that, making those connections can foster, the continuation of the accreditation process. So they do play a role. Maybe it's a more expensive role, but I think they do play an important role in the accreditation process. Walt, do you have anything else to?
I think it's important to remember that prior to travel restrictions due to COVID-19, we didn't have virtual site visits. We didn't have the capability of doing virtual site visits. In the past year, we've learned a lot on how to do these site visits. The COES, the Committee on Accreditation for the Exercise Sciences, has not made a decision whether or not we're going to go back to face-to-face. It's still an evolving kind of thing. We did learn a lot with the virtual site visits. There are some things that we also learned that we missed because we weren't doing face-to-face site visits. So we'll have to see. Maybe in the next 6 months, the virtual site visits will continue to evolve. We're working with other committees on accreditation through CEP to see what they've learned and apply it to our virtual site visits. Right now, the consensus seems to be that the COAs within CEP will continue to do some version of virtual site visits. It may be a hybrid, or it may go back to face-to-face. So we're learning a lot. You just have to be patient. Just to reemphasize, we are doing virtual site visits through the end of the spring semester. So if you're thinking about doing accreditation, you should do it now, because we could be going back to face-to-face. But again, that's going to be a decision the COES makes in consultation with the other COAs.
I will say, having gone through the virtual experience, I agree with Ben that I enjoyed it so much. I actually wish it would have been in person. If finances were not an issue, I really wish we would have had the ability to show off our facility and really dive into our program even deeper than they already did. There's definitely something with that face-to-face interaction that really kind of brings the whole experience together. So I think that's something to definitely emphasize, that it is part of the experience.
The next question is to the group. I'm going to paraphrase a little bit. NSC is no longer part of the COAES. How do exercise science programs deal with that? What's a strategy they can deal with that, both following the KHAP accreditation and then the NCA version of accreditation. So how would a program deal with that?
Maybe I can give a history of that and then toss it to Ben. The National Strength and Conditioning Association was a sponsoring organization of the Committee on Accreditation for the Exercise Sciences. Several years ago, the NSCA decided that they were going to accredit programs themselves outside of KHAP. So they left the Committee on Accreditation for the Exercise Sciences. They left the Commission on Accreditation of Allied Health Education Programs, KHAP, and created what they call the Council on Accreditation of Strength and Conditioning Education. You'll have to ask them why they left KHAP, why they left the COES. I can only tell you that we have reached out several times to their leadership to try to get them to come back to KHAP, to try to get them to come back and work with the Committee on Accreditation for the Exercise Sciences. We have so far not been able to do that. I was about to use the word fail, but I'm not going to use that term because I really would like for us to work together so that there's a single accreditation for undergraduate and for graduate programs. Ben, you want to add something to that?
Yeah, I agree, Walt. I think years ago, Deb Reby is pushing our profession forward. And I think having a split accreditation with professions can kind of muddy things. But, ultimately in my position as the chair of the COE, I'm kind of neutral. And I think that, you should really pick the accreditation that's going to be best for your students, whether it's the COES or the CASCI through NSCA. One's not better than the other. One's not more difficult than the other. They're just different.
So the next question is to the group is any recommendations and documentation that faculty can provide to their departments or schools as to why accreditation is needed, such as how well it will help students obtain jobs? So I'll leave that to the group. It's a great question. What resources does either ACSM or COES have for these faculty members?
Francis, if you capture that person's email address, I'll send them a document that we call frequently asked questions. Those are frequently asked questions over the years, but it now runs about 5 pages, single space typing. So it answers a lot of those questions, and you may ask more questions. It may develop some other questions, but that's a good document to look at. It's how to get accredited. It also answers questions, though, like if my dean is questioning or wanting to get accreditation, what do I tell him or her? So if you'll just send me the email addresses, I'll get that document to you.
And I think also, one of the outcomes that we collect is graduation rate as well as employment. And so I think that's something that's beneficial to a program is, you're preparing these students, you're having them go through, X number of years of courses. You want to find out what's going on with them afterwards. And that's something that the accreditation requires is you to actually track that and, find, are these students becoming gainfully employed after they finish your program?
The next question I'm going to give to Bill and to Monty. So prepare your mute button, Bill. So is there support from the American Heart Association, AACB, PR, and hospital associations, et cetera? So how are we engaging with like-minded organizations? I think it's the broad question.
I think that's actually for you, Francis and Monty, because you're the ones that are doing the engaging.
So I'll
go to Monty first.
I'll jump on this. And it's really, I hate to keep bringing it up, but the Physical Activity Alliance, which we joined, and help found, that's American Heart Association is part of that group. And so we get to work with them. ACBPR is not part of that, but we are in constant communication with them. We're talking with them. That's part of our coalition building. When we're trying to move things through, we want to build as large a coalition as possible to be able to help us to be supportive of the issues that we're talking about here. So they are always part of those discussions, and we try to bring in as many groups as possible. I think that's one of the things we've learned over the years as we've kind of worked issues, whether it be concussion in the states or whatever it is. The more coalition partners you can bring in to be able to help push an issue, the better. And so we find opportunities that wherever we can to be able to work with them, to be able to allow us to be able to work with them on these issues so we can drive them and be successful and ultimately in getting reimbursement for CPs and EPs.
Trying to go through the questions. Oh my gosh, that one's a really long one. Hold on. The next question is, they wanted to know as an individual, how can they advocate for our efforts of the task force? And so I think it's the context of the I'm trying to summarize is how can they get involved with the task force is one, and the second one is are there things that as an individual they can do to advocate for the professions of exercise physiology and clinical exercise physiology?
Well, I think the first thing when we talk about getting involved is, and they put the link in the chat box there for you. Please register there so we can get your name and information so we can contact you as we move forward. But also, I think it's important that if there's things that you think would be particularly interesting to us that would be helpful, whether it be research that you're doing, please, contact me, contact a member of our task force, and let them know that this is what we're doing, and we'll get you involved that way. Our task force, we're broken out into a couple different subcommittees where we're doing putting together some information that will help us to be able to advocate for our positions that we want to accomplish. And so if there's information that you have, whether it be on return on investment that CEPs provide for the healthcare system, whether it be the research itself and the jobs that you do, we're interested in getting all that information from you. And so I think that's important. But as we kind of move a little bit further down the road, that's when we're really going to come back to you after you've signed up. We're going to come back to you and say, okay, we've got this teed up. Now we need you to contact your member of Congress. And now we need you to contact this person to be able to help push things along. And so, we're still in that beginning phase here as far as when it comes to the individual advocacy efforts. But we will need you, as Brittany has so eloquently stated, that to be able to help us push things along. And it's because that's where our force is from. That's kind of where we draw our power is from you all as we kind of move things forward.
I think it's important too to realize that there's smaller efforts that can be happening in the meantime. As Monty alluded to, there's a lot of discussions that are happening with the task force that just necessarily can't be open up to the public right now. So until that happens and until we're ready to start talking with Congress members, it is simple discussions within your department, within your university. Just start the conversations there so that you can help advocate for accreditation. If you're looking to get onto a little bit wider scale, whether it's regional or national, again, ACSM, CEPA, I'll put my email in the chat. I am the co-chair for the legislative committee. That's where, again, we're reaching out, trying to get people on the same page, sharing slides, sharing information and resources so that we can have this uniform message. And then again, reaching out to colleagues across the country to just kind of see where they're at, making sure that this knowledge is as widespread as possible. So think about starting with your own unit at whichever university or hospital or clinic that you're at now. And then when you are ready to start taking those regional and national levels as well, reach out to ACSM and CEPA, where we will definitely be very receptive of those communications.
But Brittany makes a great point here. If there are colleagues that you have or the people that that might not know of the things we're doing here, please let them know. We've gone, found out, I think through LinkedIn one, we had found a group that was out there who was advocating for these kind of things. And we've started to talk with them too to kind of get them involved. But I mean, there's all these groups out there that we might not be aware of, and if you or colleagues you might not, that we're not aware of that aren't linked into what we're doing here, please invite them to be able to participate. That way we can really get more people involved.
So the next question, Monty, go ahead. Sorry.
I was just going to say, and for those of you interested in potentially getting involved in CCRB and certification and subcommittee items, when we have openings, we do have an open application process now where we'll solicit CVs and your interest. So please be on the lookout for those. That typically we have our rollover in the spring. So please be on the lookout, next spring for opportunities to engage with the CCRB as well.
So I guess I'm going to do a couple things in the chat. Monty and Walt threw in their contact information in there. During the, once we kind of close out, we did capture all the questions. We're going to answer all the questions that came in through the chat. We can't answer all of them, but certainly we're going to do that. We're also going to include the contact information of how to get involved. So just to kind of, I know that there's a couple questions that are coming in here. The next question is really to Monty. I'm not understanding what you're trying to bill for. Licensure speaks to the quality and knowledge and experience of the EP. Each licensed staff cannot be reimbursed for their services in cardiac rehab. So I guess the question is, what are we billing for and why is that important?
Yeah, that's kind of the thing our task force is really kind of focusing on right now too, is that what are the things that the CEPs and EPs could be billing for now? What could they be billing for in the future, and what's kind of the gaps in between? So we're in that process of kind of analyzing what the CPT code structure looks like and what we can really go through that process of finding the billing structure that will work for CEPs and EPs. So there, as we go through this process, though, it's going to be a long-term process, and one that as we look at some of the things, I think that low-hanging fruit that we'll be able to grab onto relatively quickly, whether it be cardiac rehab, whatever it might be. We'll certainly, or remote monitoring is another one I think we're looking at too. But there's some things out there that I think are low-hanging fruit that we will start to really work on diligently to get those done so that you can be reimbursed directly or through a licensed provider there. But from there, after that, then we're going to go a little more long-term and really kind of look towards these gaps that are there that CEPs are not listed anywhere, shape, or form that we can really kind of focus on and really kind of build the code structure so that it works for CEPs and EPs.
And just to point out in the question, we are not going for licensure. So the licensure term again is not what we're going for here.
So the next couple questions, I think I can answer. The next one is, can ACSM's website keep an updated list of programs at universities that have become accredited? This may help convince smaller programs to join the cause. From an accreditation standpoint from ACSM, there has to be a separation of church and state between the education and certification. So from the NCCA accreditation piece, we can't do that. If you're looking from a university's perspective, that's how athletic training is, like with Katie's and the BOC or the Board of Certification, they have to be separate and independent. So that is a requirement. So having it on the ACSM website wouldn't be correct. We wouldn't be able to do that. But certainly that's something that Ben and Walt can look into opportunities to put that on their website. The next question, I'll take a quick stab at it and then I'll hand over to Christy. If an individual graduated from a program many years ago and this program is not accredited, but the individual has been successful in working in the field with a wide range of patients and clients and now wants to take the CEP exam, will this be possible? The answer would be yes. You can. They have to have met the requirement in the past. The only time that's going to be enforced is starting in 2027. The individuals have to graduate from that program. Individuals who met the requirement before that would still meet the eligibility requirements. So you can find that information on the ACSM website. Kristen, do you want to add anything else to that?
I was going to say, the CEP exam does require an application process. And so what they're looking for in that application process is the equivalence of what they're requiring. So, with the hours accumulated and the curricular requirements. So, like up until 2027, if you can, establish equivalence, that application process is going to allow you to move forward. And so, if there's something that's unclear on the website, please let us know, but we can, always talk you through those requirements.
The next question is to Ben and Walt. Does specific CAHEP accreditation levels align with the ACSM exercise physiologist and clinical exercise physiologist programs? For instance, will a graduate level accreditation allow students to sit for CEP only, or can a student graduating from an accredited university sit for any ACSM certification once they graduate? So that's that is a lot of questions within one. So maybe let's like kind of piece that out a little bit. Are the CAHEP accreditation levels aligned with how do they align to different job roles? So I'll give that to Walt and Ben.
So I think the graduate accreditations, the exercise physiologists are pretty, clinical exercise physiologist is pretty specific to the clinical exercise physiologist certification, as well as ACE has a clinical certification as well. The ACSM certified exercise physiologist has some pretty specific requirements in regards to experiences with teaching resistance training and things like that, that maybe somebody in a graduate program may not have gotten. Granted, they may have gone through an undergraduate exercise physiology program and be able to meet those requirements of ACSM. So it was a loaded question, and I gave an appropriately vague answer. I don't know if Walt, do you see anything separate? That's kind of my view.
Yeah, again, the misconception about CAHEP accreditation is it's process-based, right? It's going to be tied to some kind of curriculum when it's not. We're interested in outcomes. And those outcomes for exercise physiology, exercise science undergraduate programs will be, do they get a job? One of the questions will be, do they get a job in that related discipline? Or an exercise physiologist, particular clinical exercise physiologist, do they get a job as a clinical exercise physiologist? That's what we're interested in. We do monitor pass rates on national certification exams. But our emphasis is going to be on outcomes. Now we do, in the self-study process, try to match the existing curriculum at an institution to what we call a core competency matching firm. And all that does is it matches the exercise physiology certification, clinical exercise physiology certification against your curriculum. And that's the only kind of arm's length process that we go through. We try to match those things up. Basically what it does though is you find gaps in your own curriculum and you fill those gaps on your own. We don't require that you fill those gaps, but if your student is going to be sitting for an exercise physiology certification or a clinical exercise physiology certification, you're going to want to teach those now self-identified gaps. But again, CAHEP accreditation is outcomes-based, not process-based.
Okay, so we're running up the last 2 minutes. I'm trying to look through questions that we can answer here. I think 2 of them are directed to Dr. Kraus. So let's see here. Okay, here we go. An example of billing, let's see, can a primary care physician refer a clinical exercise physiologist for health coaching and or fitness coaching? Can ACSM provide a list of, no, I think, so the question on this one is, as a physician, can you refer somebody for exercise or health coaching? How does that work? We could maybe discuss this on a different call.
Yeah, I think that's for a longer discussion, Francis, than we have. I think we need to preview what's coming up before we run out of time.
And then the last, I guess the other question was to Dr. Kraus is, Dr. Kraus, does Duke require their cardiac rehab staff to have the clinical exercise physiology certification?
I do, as director. Yes.
I think that is it for the time being. So is there any parting questions that this committee would want to provide to the audience?
I would just push for certification. I mean, accreditation, Francis. If you're, there was a great question earlier about what you can do as an individual. If your academic program is not accredited, you need to talk with the professors in that program and get your program accredited. Or if you graduated from a program that's not yet accredited, reach back out to the former professors there and ask them why their program's not accredited, and then give them my email address.
Other comments?
To address what's coming up as Bill was getting to, that the other part, that flow chart, the bigger picture when it comes to what gaps we're missing and what other efforts the task force is currently making in regards to research and QHP. I think the plan is to have additional town halls to address those components as well, so that we can give everybody the full circle, the full picture of what's going on, and again, how to get involved.
All right, this looks like we're at the bottom of the hour. We're all done here with this meeting. We do have all of your questions. We're going to address each one of those, so don't worry about that. Those are going to come across. And if you're interested in joining the next webinar, we'll send all that information on the outbound communications, and then the recording should be ready to go in the next 2 weeks or so. Okay, and I think that is it. Thank you all for joining today.
Thank you.